Hi, this is David Comfort from Democracy Action Network. In an era where public health crises loom larger than ever, the Centers for Disease Control and Prevention, CDC, the very institution tasked with safeguarding our health, finds itself in a paradoxical predicament. Mass layoffs amid escalating global threats like measles and Ebola. This contradiction isn't just a bureaucratic hiccup. It's a glaring reflection of how our political systems often prioritize short-term savings over long-term safety. Consider the historical context. During the 2014 Ebola outbreak, the CDC was hailed as a hero, leading the charge against a disease that threatened global health. Fast forward to today, and the same agency is shedding staff, the very individuals who would be on the front lines should a similar crisis arise. The irony is stark. As the world becomes more interconnected and vulnerable to outbreaks, the institutions designed to protect us are being systematically weakened. This trend isn't isolated to public health. It mirrors broader systemic issues in governance. In the wake of budget cuts and government shutdowns, agencies like the CDC are forced to make impossible choices, sacrificing expertise and experience for fiscal efficiency. This is not merely a failure of policy, it's a failure of vision. The decision-makers, often insulated from the consequences of their actions, overlook the long-term implications of their choices. Moreover, these cuts disproportionately affect marginalized communities who rely heavily on public health initiatives. When funding is slashed, it is often the most vulnerable who bear the brunt of these decisions, highlighting a troubling pattern of inequity in health access. The CDC's staff reductions are not just numbers on a spreadsheet. They represent real people, real expertise, and ultimately, real lives at risk. As we grapple with the specter of disease outbreaks and the ever-present threat of pandemics, the question becomes clear. How do we prioritize public health in a political landscape that often seems indifferent? The answer lies in reimagining our approach to governance, one that values foresight over short-term gains, one that recognizes the intrinsic link between health and equity. The takeaway is profound. In a world rife with uncertainty, investing in our public health infrastructure is not merely a choice, it is an imperative. To safeguard our future, we must advocate for policies that prioritize the CDC and similar institutions, ensuring they are equipped to face the challenges ahead. Only then can we truly protect the health of our nation and the world. Please like this video and subscribe to our channel. It would help out a lot. Peace.